Welcome to River City Plus. It is the show after the show, and today we have joining us again, Melissa and Nikki from Rebel Recovery Jacksonville, and we're in this era where there's a lot of drug use and abuse going on, and there's situations people come in and there's overdosing going on, and their company or their organization is focused on bringing awareness to that and preventing them as best they can. So first off, thank you guys for doing what you do for the community.
Thank you for having us.
So for those that might have missed our first conversation, talk a little bit about what Rebel Recovery is about.
Right. So Rebel Recovery is a harm reduction organization where we meet people where they're at, whether they're struggling with substance use or they have a history of substance use. We want to just walk alongside with them and explore what recovery looks like to them. We explore what recovery journey or pathway that they want to utilize, and we walk with them. We're people who have a history and lived experience of substance use and been able to overcome our challenges and our barriers. And we've been able to educate ourselves and become peer support specialists to be able to join the workforce in the behavioral health care field, to be able to support others that are struggling just like we have.
So you and Nikki all met 5 years ago, and basically like, we want to make a change. We want to make an impact on the community. Why did this appeal to you guys?
Well, I entered the field right after I got into recovery, and about a year and a half in, I lost one of my best friends to an overdose in a public space, and it was really traumatic for me. I had a support network at the time, and they actually weren't very supportive. So I figured that I needed to go and do something that was good for me and that was going to keep me out of trouble while I was grieving his death. So I started going to the street with Narcan and wound care supplies and just talking to people about their barriers and their experiences and providing the life-saving tools so that they could, make it to another part of their life where they can be well.
What does that mean? You said you had a support group, but they weren't very supportive. Like, so say somebody doesn't understand the path that you two have walked or that somebody has walked. How can people be supportive? I mean, besides connecting them with you, but me as somebody outside looking in, how can I be supportive and actually make that person feel supported, not like I'm just paying lip service?
So all the services and all the relationships that we build are very objective. It's never that I'm putting my beliefs on anybody. So we render our services under what we call a trauma-informed lens. And so if you think about your relationships in that way or the people that you're coming across, understanding that everybody has been through troubles and things that are traumatic that change the way that they live their lives and respond to things. And so just understanding that that's why somebody might be doing what they're doing, whether it's drugs or whatever harmful behavior, is understanding that that was a coping mechanism that worked for them at some point and now it's not anymore. So let's see how we can take the next step together. I'm not going to sit here and judge you for your decisions. You made them for a reason.
Ooh, that's a very interesting perspective. So basically, you're taking yourself out of it, and like you say, you're not painting your influence on it. You're actually just, I'm listening to you. I'm here for you. Mm-hmm. So you mentioned that you guys have prevented, that you know of, over 200 some odd overdoses. How did that happen? How did you guys do that?
Well, we've been tracking our data and our distribution rates. We have a team of peer support specialists that part of their job detail is to go and conduct outreach. So they'll go and either it's an assigned at an agency or they're just going out doing rogue outreach in the community. Like I said, meeting people where they're at, going to hotels, going to bars, restaurants, maybe strip clubs, and just educating and giving the medication for free. And we'll put our label on it, and people can report back to us that a reversal was made. And so we've had about 253 overdose reversals reported back to us, and that is not reported to JSO or JFRD.
What does it mean for you? Because I mean, I know you guys are based here, but you say you're spreading your message all across Florida and across the country. So, what does it mean for you that you're able to connect with people and that people want to hear your message and what you guys are trying to do?
I mean, it's amazing because we're a part of a statewide initiative called the Florida Harm Reduction Collective. And it's a group of smaller grassroots orgs like us that go out and do the same work. And when we get together and talk about the work that we're doing in our community, we can see the impact, not just locally, but statewide.
So, people, this is what we call a segue. They've got an event coming up, and they're inviting you guys to come and have some conversations with them, listen to some testimony. You know what? I'll let you guys tell what's going on. So, break it down.
Yeah, thank you. So Florida Harm Reduction Collective is a statewide agency, and they provide some direct services, but a lot of advocacy to support harm reduction initiatives in Florida. There's a lot of legislation that's working against our programs that are preventing deaths. In this month, the 29th and the 30th, we are having a conference called Florida Harm Reduction. I think it's the third annual conference, but tickets are still available if you want to come see the innovative work that's happening around the state and hear from people that are directly impacted and have lived experience. We're going to have a lot of panels. There are some on sex work. There are some specifically focusing on Black and people of color in harm reduction and all kinds of other innovative programs. And we would love for people to come. There's still a few tickets left. If you go to flhrc.org, you can purchase a ticket and come see us in St. Petersburg, Florida on the 29th and 30th. Melissa and I will be presenting on how we've implemented harm reduction practices into a recovery community organization. So we're really excited.
So that's a pretty major deal. Are you guys going to be doing anything locally where people can kind of connect with you here as well?
I don't think we have anything specifically planned, but people can always come in and walk into our office and talk to us if they have a family member that's struggling or if they're struggling and don't know what to do. That's our whole job, is to support people while they're struggling. So we're open Monday to Friday, 9 to 5, and we're located at 3811 Blanding Boulevard. So people are welcome to come in and grab Narcan, fentanyl test strips, and get a hug. You know, we're here to support people.
How hard is it to have those conversations? So somebody comes in, I have somebody that I care about, they're going through some things, and I'm really worried that, you know, there could be a bad result, a bad ending to this. How hard is it for people to step in and have that conversation with you, let alone have that conversation with that person?
Well, just this week, I had a young lady come into my office, and I'm the director of peer support, so I'm very personable. I love to even talk with my participants or potential participants and give them a piece of who I am and, you know, how I can relate to what they're going through. But it was wonderful. She came in, I had my peer navigator sit with me in the office, and we just had a conversation. She opened up. We talked to her about, well, what does it look like for you? What is it that you would like to do? And she was very nervous when she came in. By the time she left, she was relieved, you know, that she had two other individuals who understand what she was going through. We were able to enroll her into services, and we're going to support her weekly. So now, you know, just by that engagement alone, you know, we could see the change within that short time frame, that she doesn't have to walk this journey by herself, and that there's other people there that are willing to show her new coping skills and new ways into her pathway to recovery.
Is your organization open to volunteers or people help joining in and or at least learning the process and becoming part of your team?
So right now I don't have a lot for volunteers to do, but we want to develop our program so that in the future there will be opportunities. Melissa and I just started teaching a curriculum called From Peer to Practice. Our CEO and our CPO, Krister and Nancy, actually developed this curriculum, and it satisfies all the requirements needed in order to get your peer support certification from the Florida Certification Board. So we have a training coming up in the middle of December that people can sign up for and get the education requirement for the certification.
All right, hit them with the website.
jax.rebelrco.org.
She's like, you just threw me under the bus.
And we also are open to educating the community, and whether it's a regular citizen or a community agency, we do have the overdose response and naloxone training. So anybody can get trained on the spot, or we can come out and do a big community training. Harm Reduction 101, and we have some for like trauma informed, stigma reduction. So we're just trying to bring ourselves to the community and let them know that, we're here and we have resources available for the community.
So, you guys, there's some tough conversations that need to be had sometime. Rebel Recovery is here to help you with those conversations, whichever side of that conversation you need to be on. So thank you guys for hanging out. And again, thanks for what you're doing for the community. And I look forward to seeing what you guys keep doing as you move forward.
Thank you.
So we're about to wrap it up. We hope everybody has a great weekend. Stay safe, stay warm. It's kind of nice weather out. It's kind of cool. It feels like fall. We'll be back Monday at 10:15 for River City Plus, and Jana will be back with us Monday 9:30 for River City Live.